The question this week is, what's new at ASH this year? Well, for ASH this year, which is the American Society of Hematology meeting, which is upcoming in December, first part of December in San Francisco, there were 855 abstracts submitted dealing with myeloma this year. So a very large number, very similar to the past. This year, there are a few things which are special about the meeting. The first is that there is a lot of information about how to best use the novel agents that have been introduced within the past 10 to 15 years. And this is an extremely important step. These novel agents include both Kyprolis and Pomalyst, the most recently approved of the novel agents. The top abstract to be presented at an oral session on Sunday this year is concerning the ASPIRE trial, which is a large randomized study in which the combination of Kyprolis along with Revlimid and low-dose Dex is compared with Revlimid and low-dose Dex alone in patients who have had 1 to 3 relapses. So this is not a frontline trial, it's in the relapse setting. And these are very, very exciting data because they show the added benefit of adding the Kyprolis to the Revlimid and Dex in this setting with a higher level of deeper responses and also prolongation of remission in what seems to be in the 9-month range. So a significant benefit by adding Kyprolis to Revlimid and Dex. And so people are very excited to hear the final details of this particular protocol. In addition to that, there are a lot of abstracts that deal with new diagnostic testing and monitoring procedures, such things as imaging. There are abstracts on PET-CT scanning, showing the value of PET-CT scanning for early diagnosis and follow-up monitoring. The use of both the heavy light and the free light tests, very important new data. One aspect is the recommendation to use the blood free light test to monitor the light chain or Bench-Jones protein rather than using the 24-hour urine. So this would be a tremendous benefit for patients if this turns out to be strongly validated and supported. And then there are this year a total of 9 abstracts that deal with minimal residual disease, the testing of the bone marrow to see if any myeloma is left in the marrow. And this is very exciting to see the emphasis on this type of testing and the value that is coming from all of these different studies, which encompass over 1,000 patients that will have data presented between these different trials to show what is the value of this type of close monitoring of the bone marrow. And then finally, we do have some updates on new drugs which are coming through the pipeline. These are mostly drugs that you have heard about before. There are protocols presented dealing with daratumumab and the SAR compound. These are anti-CD38 antibodies and promising results used both as single agents and in combination. And then the orally active proteasome inhibitors. And so this is great to see these drugs coming forward. The version of Velcade, which is called Ixazomib. This is an oral agent. Data will be presented on that. And then Oprozumib, which is the oral version of Kyprolis, and data will be presented on that. So very exciting to see these types of drugs moving forward in an oral form. And so yet again, an exciting ASH this year. I did a blog on November 20th, and the blog does link to a number of these key abstracts, so please make use of that if that would be helpful to you. So, as always, a lot of important new information coming in December.